Hey, well, thank you so much for letting us join for just a few minutes. Like you had mentioned, my name is Mark Peterson, Director of Admissions. Dr. Fotai is our Program Director for the MSN degree program online. And we'll also have joining with us Jamie Doby and Laura Lincoln, who are our senior advisors from the admissions side, perhaps at the end, who may have a few questions that they answer. But to get things started, we have a few slides to review just to share a little bit of information about this program and why we're excited about it, and hopefully why it could be a program and a next step for all of you who are upcoming BSN graduates. Exciting. Congratulations to you all. You're all going to finish very well, we know. And then hopefully, as a career move for many of you, the family nurse practitioner track could be something that's on the horizon for you. So we want to make sure we had a chance to meet with you, share with you, and answer any questions you may have before you do graduate and go become awesome nurses out there. So with that, I'll hand it over to Dr. Fotai. And one thing I would ask, if you do have questions, you can type them into the chat. Currently, I'm not 100% sure where I'm going to see where the chat is. I'm feeling a little lost in my Teams environment right now, but that might be the easiest. And Tracy, if you also see a question that I don't see, I'll try to interrupt Dr. Fotai and share it. But if you see it and I don't, you please help throw it out there so no one needs to wait. This will be formally informal, and we'll just take a few minutes of your time and roll through it. So Dr. Fotai. I'm not hearing you if you're speaking, Dr. Fotai. I'm not the only one.
Can you hear me now?
Yes, ma'am.
Oh, okay. I said all that for nothing.
Listen, I'm sure it was perfect. It was the right warm-up.
Okay, well, welcome and thank you for attending our webinar. And it's going to be, we'll make it brief, and definitely type in those questions as they come to mind so that we can make sure that we address them, and you don't forget what those questions are. So anyway, I am the MSN Nurse Administrator for the MSN program. We have two concentrations. We have the nursing education concentration. We have the family nurse practitioner concentration. So today we're here really to focus on the family nurse practitioner concentration. I do have some slides I'll go through. Some are not going to be as important to you right now at this stage as it may be later. So I'll try to be brief in going through those slides. We've graduated several family nurse practitioner students from the Orlando campus. And we're happy to report that we have many out there now working as family nurse practitioners because they've been successful in taking their family nurse practitioner board certification exam. So for any of you who are interested in doing the same thing, we've got a great program for you and you can get it done in 22 months. And so without further ado, I'll kind of go through a few of these slides and let you know if you've got any questions. Okay. So this is just a little bit of information about ECPI University. You've been in a program already with them. It may be one, two, several programs at this point. So you know that they're 5-week terms, they're small classes. Everything's kind of hands-on when it comes to our skills part of our program, but it's really almost all of it is online. Okay, so it is remote. And we'll get into a little bit more about what is not remote. But there is just a couple of times you do come to the Virginia Beach area for some skills. Okay, so why become a family nurse practitioner? It's a great opportunity on a number of different levels. You can enhance your patient treatment knowledge. If you're advancing to your next level in your career, it's a great rewarding position to have. And of course, there is some economic benefits to it as well. So FNPs are licensed in all states and the DC area, okay? And so there are a number of different areas for which a family nurse practitioner can work. It just kind of depends on the direction of the path that you take. We prepare you to work in a number of different areas, but there are areas that are specific that maybe like a, you know, if you wanted to be women's health, you would want to be in a women's health practice, you know, so we do a lot of family practice settings for you. You're going to be able to counsel not students, I want to say students, but patients prescribe medications, order perform tests. So there's a lot of different aspects to becoming a family nurse practitioner. So it's interesting to always keep up with the facts about FNPs and where they are in terms of their area of specialty. So for instance, 88.9% of FNPs currently work in a primary care setting. Okay, there's in 2020, the mean full-time base salary for an FNP was $110,000. So we haven't seen those numbers for 2021 yet. And in this little slide here just kind of talks about how often they see patients. And all right, so then of course your program is CCNE accredited, as is our MSN program. We have 5-week terms. There's 49 credits. You completed it in 22 months. It's online. All our faculty are currently in practice, so you're going to get knowledgeable faculty leading you in your courses. And we actually have resources built into our program that help prepare you for board certification. Okay. Let's see. We do live Zooms. We have low faculty to student ratios. So you're not going to have a class of 30, 40, 50 students in one faculty. On average, I would say maybe about 10 to 15 students per faculty member. And when you get to your practicums, though, we narrow that down, and it's only 6 students to one faculty member. We have an MSN practicum coordinator who works for the program, and his responsibility is to help assist you in the acquisition of practicum preceptors. So yes, there is some onus on you to locate preceptors, but in the event that you have a hard time and you've gone through the process that's outlined by the program to look for those preceptors, we jump in and we try to help you find a preceptor that's going to be appropriate for the course that you're taking. We have 2 on-campus residencies, and so this is one of the most exciting parts about our program, as reported by students. They come out of these residencies just lit, like everything has connected. Everything they've been teaching up, we've been teaching up to this point, they've been learning, is like, wow, now I get it. Now I can see why that all fits into where we are today, and how that's going to work as we progress through the rest of the program. So you get to do things like punch biopsies, suturing, you do vaginal prostate exams, nail removals. You do have live standardized patients. So, and these patients know their bodies extremely well. It's part of their work and their job. So you do have actual live patients that you perform exams on. So students find that a very rewarding and a great learning experience, and it's in an environment that's not punitive. It's very teaching. It's teaching focused, making sure that if you didn't get something, that they can help you understand what maybe you didn't understand as much as you had wanted to. So it's a great experience. It's in Virginia. It's the Virginia Beach, Norfolk area, and we do that halfway through the program, and then we do it at the end of the program. Okay, so again, we're accredited by CCNE, so that's an important thing when you're looking for a program. This picture here, this is your practicum coordinator. Okay, this is Dr. Warrington, this is me, and this is Dr. Vishnesky, and she's been a critical, they both have been critical part of our team since the inception of our program. So the ANCC and the AAMP, now these 2 organizations are the certifying, where you take your board certification exams. You can take either one, you can take both. Don't know why you want to take both. I think one's hard enough, in terms of having just have to study for it and being nervous. But I got to tell you, our students are doing really, really well with passing their board certification exam. We have definitely exceeded the requirement for our accreditation for pass rates. Okay. Do you want to talk about, Mr. Peterson, about the Enterprise Partnership Program?
Absolutely. And to this point, and that was incredible information. I didn't see a question pop up. Tracy, did I miss any? Okay, awesome.
No, you didn't. Does anyone have any questions that you want to ask to this point?
I've got a couple more things I can add. We do have, I want to talk a little bit about our resources and some of the things we provide. We do provide lab coats. We do provide health assessment kits. We give you ID badges. We, as I mentioned earlier, we integrate resources to help prepare you for the board certification exam. We do that with APEA question banks, a 3Ps exam. We do it with a pre-predictor and a post-predictor. We also incorporate another form of technology called Shadow Health. You may be familiar with that if you are in a BSN program. That's a digital clinical experience. Students love that. So we have a lot of different, different mechanisms of helping you learn the material. We do have recorded Zoom sessions and live Zoom sessions. Our faculty are available to you all week long. The resources are definitely there, and we help you get to the point where, you're going to feel comfortable taking the exam, okay, for your FNP.
Awesome. Yeah, absolutely. So when we talk about EPP, this is a quick slide, but it's critical. Many of you are likely to be employed with a healthcare facility where we have a partnership. And what that essentially could mean for you is you may be looking at an opportunity where they'll offer you some type of a tuition assistance as a new hire, and that might be applicable to any program where you would attend, not just ECPI. So I would, one, encourage you to take advantage of that with your new employer to help offset your investment into an MSN should you attend. But then also we have many, many employers in your area, up and down the East Coast, and actually across the country, where that partnership for you is pretty simple. You work there, and then as you have payments towards your program, we'll match those payments. So we'll help to reduce the total investment that you'll have in your program, along with what could be a lower expense for you for tuition if you choose to use that tuition assistance towards your tuition. So I leave that kind of open because you may end up working for a facility that we don't have a partnership with yet. And should that be the case, talk to our admissions people and we can get with our partnership manager, and perhaps we could have that set up in the future. But many, and we're talking hundreds of healthcare facilities we have that partnership with. Ultimately, the goal is to be able to help them and help you be able to progress through your next degree programs, current degree programs, so that it's mutually beneficial, saving you money on your program and certainly helps your employer. And then, of course, we're happy to have you. We'd love to have you as a student for the next program as well. So I'll keep it broad there, but just know that's a pretty neat opportunity related to your tuition and understanding that tuition and investment matters. We understand that. So hitting on a couple of the next steps, or so what's next, right? How do I find out if I can apply? Because this really is, to echo Dr. Fotai, I've seen them build and launch this over the last few years, and it's been incredible. The amount of time and energy and work that has gone into it, and the success rates of these students who have moved through and graduated, tested, and become family nurse practitioners it's so exciting. And that certainly could be a path for you as well. And like I said, we'd love to be able to have you consider this program should that be your choice. And so we try to make that process streamlined and smooth for all of our graduates. We want it streamlined and smooth for everybody, but we certainly want it to be streamlined and smooth for our graduates from Orlando, from our online BSN program, and now from our accelerated BSN programs that we're offering here in Virginia Beach. So to just kind of hit on a couple of those next steps, the names of the individuals who you would be speaking with as part of an interview, what type of steps do I need to get done, more detailed questions, right? Because Dr. Fotai has gone into a lot of intense information. We can then parse out, so things that may be more related to admissions or some of that logistical information will be Laura Lincoln or Jamie Doby. They're both of our senior advisors who handle our MSN enrollment. They are awesome. I invited them to this so that you could hear their voice, because you've probably seen an email from them and you didn't know who we were. We promise we're not trying to harass you. What we want is to be able to provide you great customer and student support and service so that you can have all of your questions answered and make a great decision as you move from your BSN onto your next degree. So with that, I just asked them to highlight a couple of the next steps generally, and then we'll wrap up with any other questions and give it back to Dr. Fotai and Tracy. So Jamie or Laura?
Hello, I'm Jamie. Can you hear me okay?
Yes, ma'am.
Awesome. Awesome. Okay. So really, the process is really seamless for our graduates, which is great. We'll get your transcripts for you. So you just would need to speak with either Laura or myself. We'll give you specific details in regards to the program. Just need to update your application and just submit a couple of documents. Like I said, you all would submit less than someone who was not a graduate. So it is really just a seamless process for our students. We try to make it as easy as possible.
And my name's Laura Lincoln. I also help with the admissions for our MSN FNP students. To point on that, the other things you may need just to kind of give you a heads up for application are very simple. It's a resume, your RN license number, as you are required to have some RN experience, at least 3 months. And then we would have an essay requirement as well as part of our application process. We help you through all of these. We also go over finance options. Obviously, you'll work with financial aid on that, but you can apply for graduate level student loans, and as well as the EPP, which is the partnerships with employers that are offered as well. So we'll go through all those options with you as we get closer. Good reasons to follow up with us and make everything a little easier for you. And we'll walk you through everything. The only other things to point out would be, obviously, there's no application or registration fee for our graduates. So that's important and a plus for you as well. And you're somewhat familiar. It's more accelerated than what you're doing now in Orlando, but you're used to some type of acceleration. But this is going to be even a little more beyond that. So we look forward to helping you. I think Jamie and I will be reaching out to all of you individually, so you'll hear from one of us in the coming months.
And don't be afraid of the essay. Just so you know, I know that usually is like a point where I don't have to write an essay. That essay really is just simply to get and to have an understanding of your writing skills in the event that we think maybe you could use a little bit of help. Oh, and it's also simply because we want to make you aware of some of the things that you can expect in the program. So the questions in the essay are designed to help us, to help you realize what those things are. So it's really kind of twofold for that essay. So it's not graded or anything. It's just something that we have, that we assess, and we just try to make sure that you're okay. That you know exactly what to expect in terms of the number of hours that you could expect to put into the program on a weekly basis. And I don't know how many hours you put into your ABSN program. I'm kind of curious if someone could give me an idea of what that is. Can anyone share like how many hours it takes a week to for your ABSN program? No one special, just anyone.
Silence.
Yeah, I'm not sure. The students are being very shy, and this isn't too shy of a group. So the ABSN program that these students are in, they're in 12-week sessions, but they're taking up to 4 to 5 classes at a time.
Right.
So even though it's not 5 weeks, it is still accelerated because their workload is so much more. In addition to that, they're doing clinical hours. So time-wise, just the time that they spend in class, all of our classes are remote synchronous. So they have to, this is like a 4-hour course. And then the hours they put in outside of class in addition to clinicals, I don't have an exact number, but it's a pretty tremendous amount. So although it's not 5-week sessions, I think they're well equipped to be in an accelerated program.
Right. Yeah. I think that was my point, because I don't know that we really would be considered more accelerated. For the most part, it's 1 class at a time. And there's a couple of instances where it's 2 classes, but they're light. They're
Right.
lighter classes. So don't let that scare you. Okay. So without knowing those numbers, the other thing I wanted to point out is too, for the practicums, The practicum courses, those are 1-credit courses, and they are 60 hours for each practicum. And so you can span that 60 hours over the 5 weeks any way you like. Any way you like. We don't tell you how, we don't tell you, we tell you when. We just say you need 60 hours of practicum at the end of the term. Okay. And I wanted to point out that the young lady on the slide right here, she is actually an ABSN grad and now working as an FMP.
That is awesome. That's a great picture, by the way. I know who took it.
She's a great. She came from y'all's program. She was great.
So let me add my final shot before we're wrapped with anything else that Dr. Fotai or Tracy may have before I'm out. But as a call to action, it's likely a when, not if, that you're looking at vertical from a BSN to an MSN. FMP is is a great opportunity in that field, right? It might not be for everybody, but it's certainly a great opportunity when you look at where could you go next. So again, our invitation would be to consider, give it a look, really reply back to Jamie or Laura, have a connection and a conversation. We have a cohort that'll start in January that you'd be eligible for. So that'll give you a minute to be able to get to work and kind of become that great nurse and then not get too far out of your academic habits. Because the further away you get from school, the harder it is to get back into school. Remember I said that? But then really evaluate, right? See if it's something that could be the right next step for you. Because I think you'd find, like Dr. Fotai was just sharing, the juggle will be there. It will be challenging. It will be work. That's why it's an awesome career move for BSNs to move into that MSN FMP role. But this program is certainly doing an outstanding job training BSNs to become MSN FMPs. So we would be thrilled, excited to be able to have an opportunity to meet with you, talk with you, help you evaluate your options, look at how much, how long, what do those details look like, what do I need to do to be able to be vetted and accepted and preparing to start. And again, generally speaking, that starts with you just replying back to an email or picking up a phone as Jamie and Laura reach out to you. As I mentioned a few minutes ago, we're not in the business of trying to harass anybody. You are our students, you are our graduates. We appreciate you. We work for you. So certainly we don't want to be an inconvenience, but we are proud of this program and we're excited to be able to have you consider it. So reply back, let them know if it's something that you'd like to check out. And then perhaps you'll see just how much value there is there for you professionally and make that move forward. That's all I've got.
Add one more thing, just one more thing. I didn't mention that we have an orientation. It's a 1-week orientation. Okay, and that orientation is to help you get acclimated to the resources that we use in the program. And so that you also know how to do the discussion boards, because you're coming from an on-campus, well, barring the COVID restrictions, but for the most part, on-campus environment. So we help you learn how to do the discussion questions and how to use the technology to make that happen. So there's just different things that we want to get you acclimated to before you start your program. So that usually starts 2 weeks before the beginning of the program start date. Okay, so you do the 1-week orientation, take a breather for a week, and then you start your program. Okay.
There is a question from a student. Are we responsible for finding our own practicum spots?
Okay, so this is the way that there's a process in place. And that process is you start to look for you want to network with people that you work with, or even friends, other students to locate preceptors, because you're going to want to choose a preceptor that you think it's going to be best for you, and that also meets our guidelines for that particular practicum course. So we encourage you to get those preceptors. So what happens is if you've looked for preceptors and you've made certain number of contacts and you can't, then what happens is you send over this list of contacts that you've made to our practicum coordinator. He reviews those, okay, the list, to see if he can work within that list, because of course you're going to choose preceptors that are as close to home as possible, right? So he tries to see if there's anything he can do with that list that you've attempted, to get use for preceptors. If that does not come to fruition, then he will look for other preceptors that are in your backyard. Okay. If that doesn't work, then we try to find a preceptor outside of your backyard. And that's why students, for the most part, like to try to find their own preceptors, because if at least they're more in touch with their area and, you know, like where they're living, and so they don't have to drive as far for their practicum preceptorship. If they would prefer to do that than have us have to look, you know, further outside their back door. It might be in North Carolina. It might be in Florida. You know, we've got a lot of contacts, especially in those two states. We also, I will tell you, we provide you a database of all the different preceptorships that have taken place in our program. So that gives you some sort of list to at least look at to consider when looking for preceptors. We do not provide you the actual preceptor because preceptors do move around. They have, you know, they don't stay in one place for a long time in some cases. Some do, some don't. So it's just the practice clinic we give you the information to, you too. So yes, in the beginning, we encourage you, go try to find these preceptors because they're going to be the ones that you want. And then if you are not successful in doing that, then we will step in, we will try to find them for you. If we can't find them in your backyard, we need to make sure that we find one, you know, outside of your backyard. Okay. You know, there's little things in there too, like we got to make sure, you know, that they're a compact state, you know, if you're going to go to a different state. So there's little things in there. So the practicum coordinator really has a great handle on this and what it takes. But there is a responsibility on the part of the student to start looking for those preceptors.
All right, another question. I know you mentioned that we would have to go to Virginia occasionally. Do you have an estimate of how many times throughout the program we would have to go to campus and for how long? Example, yes. Would it be for a weekend or just a day?
At present, you come during term 9, which is the midway point of the program because there's 18 terms. Okay, and that first one is a 2.5-day residency. It's a Thursday, Friday, half a Saturday. Okay, and then you come at the end of program, which is term 18. And that is just a 1-day residency, and we hold it on a Friday. And then we also do a pinning ceremony, you know, with cake and light refreshments and that sort of thing. So yeah, it's in the middle, it's at the end. They're, like I said, Thursday, Friday, half a Saturday in the middle, a Friday on the at the end.
So I have a question on their behalf. On our campus, we have a campus librarian that they have readily accessible to them. What does that look like in an online program? Could you just briefly describe some of the resources that are available to them since they won't be attending be close to a campus?
I mean, they're the same resources. It's just that you don't walk into a physical place unless you want to. If you want to be on our campus, you can walk in. They're just available just online. I mean, we still have all the journals and the articles and you can still get books, you can get interlibrary loans. So definitely I've not heard that to be an issue. If it is, I'm not aware.
And to add to that, so what we would basically say what Dr. Fotai said, which is you're coming to the online campus, you can expect and you should expect the same service and support and access that you do at any of our campuses, Orlando, Virginia Beach, or anywhere. That goes for student services, career services, financial services, admissions, support from the faculty, and it's going to be virtual. Generally, unless you're here for the residencies, but their contact, speed, interactions, everything that we can provide a student in a virtual setting should have a very tight mirror to what would be available on campus.
And I have to take a second and brag on our university because we provide these residencies, okay? And this kind of residency is not, you don't see this in every university offering this. They will have you do your practicums and have you do your program, but this is an added bonus, okay, that the ECPI University provides. And so, I mean, it blows me away that we have this because it's such an amazing contribution to our program. Like I said, when our students go through this process of these residencies, I cannot tell you how excited they are. I mean, just the smiles on their faces and the camaraderie and their relationships and the skills they've learned they just, I mean, they're just over the moon excited. That's all I can say. And it's so great to be a part of that, you know, to know that we're playing a role and a part in that excitement and their career path.
Another question that I've heard from students, and I know you briefly touched on it, that there's opportunity for tuition assistance. As an ECPI graduate, is there a discount in the tuition, like automatically, or is it just that tuition assistance available through the partners?
I can speak to this if you'd like, Mark.
Yep.
There can be what we call a student advancement scholarship for our graduates coming directly from the BSN. Basically, ECPI University wants to save you as much money as possible, whether that be through that what it is currently, which is always subject to change, a $1,000 degree advancement scholarship off of your tuition, or if you have the educational partnership through your employer, which may provide tuition reimbursement or may provide ECPI matching out-of-pocket payments for you or matching that tuition reimbursement, we're going to give you whichever one provides you the greatest discounts. And that's something you'll work with financial aid through. But yes, regardless, you should expect some type of, if you're not eligible for tuition reimbursement, in which we would match through an educational partnership, we will provide at this point some type of tuition degree advancement scholarship of around $1,000.
Laura, you may know this, our two big hospital systems here in Central Florida are Orlando Health and Advent Health. Do you know if they're part of that?
Yes, they are partnerships with ECPI, I believe university partners. And there have been times where we just have to check with them, right? Because everything is subject to change with our partners. So it's something we'll check on when the student is applying. But yes, those are regular partners of the university.
And we work very closely with Orlando Health for practicum acquisition. We've got a lot of students doing practicums and working with Orlando Health.
Excellent, thank you. And I had one additional question and it will come to me. Does anyone else have a question? This is your opportunity. Questions about the program? Oh, I remember my question real quick. So when you said there's a 3-month, do they have to be working for 3 months or licensed for 3 months to qualify?
Working.
Working, okay.
And let me just speak to that on why. Because when you first start your RN position, you're going to go through a training, right? You're going to go through some sort of, whether it's a 3-month or 6-month, you know. So when we first ran the program, we were taking in students that were straight right out of the BSN program. And what they were finding was it was difficult to balance the new job, the orientation program with their new job, and then a program. So then what we ascertained was that it would be better to give them about a 3-month window to go ahead and get that experience and get that orientation over with. And so they're better positioned to start an academic program. And that really worked out well because we found that we were letting the students come in, or applicants come in from the first 2 cohorts. And we found this is challenging for them. We're not doing them a service. So then when we started the 3rd cohort, we changed it to having 3 months experience. So that way they've gotten some of those things out of the way and they were better positioned to start a program. And then we saw the retention numbers really increase because now it was more doable. So that really is the reason. We want to make sure we're setting you up for success and not failure. That's the reason for the 3-month work experience. I hope that answers your question.
Absolutely. And then Maggie, I saw that you posted a question. For some reason, I'm not seeing it on my own. Can you unmute your microphone and ask?
Yes, I just want to know what's the application cycle? Like when do we have to apply and when is it open for applications?
Okay, I will speak. So since you would likely be eligible come January 2022, because you still need those 3 months of RN work experience first, we can start the conversations really anytime after or leading up to you completing your BSN, but we can't submit you into the system for evaluation until you meet all criteria, meaning that until you have those 3 months work experience to put on a resume. So we're happy to begin the process, send you what you would need to do. But again, we can't go through submitting you for acceptance or approval for acceptance prior to having all of those bullet points met. So you graduate when? I'm sorry, I don't think I got that. When does this group graduate, Tracy?
July, like the middle of July.
July, okay. So likely come fall, we could start having those conversations, whether that be in August or September, see where you are with work, see when you'll meet that 3-month work mark. And then usually we'll just follow up at that time and make sure you do have that work experience and go through that application process with you in full in submitting you to the panel for evaluation.
Okay. Sorry.
No, good.
If it's a little early, shy of the 3 months, I take that into consideration that you're with that employer and that by the time that you are going to come in January, that you will have met the 3 months. Okay, so we'll ask probably for an updated CV that reflects that. Okay, but we can still have those conversations and start that process.
Correct.
And I have one more question to confirm and just kind of reassure the students. Most of our students accept full-time jobs. So this program is designed for a full-time working nurse to be able to successfully complete that program in 22 months, correct?
I'm so glad you asked that question. And that actually is one of the, I think we might have put that question on the essay. Okay, see, because full-time for one person is not the same thing as a full-time for another person, okay? So what we found was students are saying, well, I thought that you said you could work full-time in this program. And I'd say, well, how many hours are you working? About 62 hours a week. Okay, that's full-time, but that is really full-time, right? So the normal full-time for an RN is supposed to be three 12-hour shifts, okay? So that's a full-time load for an RN is 3 12s. And so I've had no issues with students who are doing 3 12s getting through the program. Now, it's the students who are doing way over that will struggle. Okay, so and you also have to take in consideration some applicants or students at the time might have 5 kids at home. They're working full time. They're about to have a baby, or they're about to get married, or there's different life events going on that they have to take into consideration whether it's a good time for them, because sometimes we all know life just gets in the way, right? So then maybe it's not the right time. So just take into consideration, if I had students who have families and work 3 12 and be successful, absolutely, no question. It's really where we've seen this. I've even had a student who had 5 kids at home, all they were young little kids. She was successful as an FNP, okay, and she was working. So it has a lot to do with your study skills and your organization skills. There's so much that plays into it. Are you the type of learner you are? And so those are things that are important. And we talk about that in orientation because that is a critical piece. Again, where I've seen students struggle is when they're working way more than their 36, 40-hour work week. That's where I've seen students run into trouble. And we notice though, we're like, I've got a feeling that this student is maybe working a little bit more than the typical 36, 40-hour work week. And usually we find out that it is. They're picking up extra shifts here and there. And so, yeah. But is it doable for that to work 36 hours and do this program? Absolutely. Absolutely. Plenty of students have done it and they're successful and they're working as FNPs right now.
Another question, what's the program acceptance rate, total of applicants applied, and how many are accepted?
Oh, it's really good. I can't give you those numbers, but Mr. Peterson, do you know those numbers? I look through all the applicants, and I will be honest with you, because I do the final approval on the applicants, and there are very few that I don't push through. The only way that I can't push them through is if they don't have at least a 2.5 GPA in their BSN program. You know, I've got to make sure they got that essay in there. I've got to make sure that they're licensed in their state of residence. I've got to make sure that they're coming from a state where we can work with them. If you live in California, I can't work with you. They've got their own set of rules. You know, so there's just different criteria that you have to go through, but they're normal. They usually never affect the Orlando ABSN program, because you've already done what you need to do to get into the ECPI program. And do you have to have at least a 2.5 to graduate from your program, or what do you need?
I don't know what the exact GPA is, but it's basically they have to achieve C's or higher in the program, and it's a 77%. So I don't know what the overall, but I know, I'm glad you hit on that, because students from the day they start the BSN program are concerned with their GPA to get into graduate school.
Right.
So what you're saying is it needs to be
a 2.5. 2.5. Mm-hmm. And and then you have to maintain a 3.0 in our program. And you're going to find that in any graduate program. You know, we do have a little bit of a lower GPA requirement than most programs.
A student asked a question, kind of like what you were talking about. She said, I know you mentioned about the non-compact states. Are they allowed to do practicums in a non-compact state?
It depends on if they're licensed, if they have a license there. So it gets a little weird. Some students will sometimes apply for a license in another state so that they can work there. That's something the practicum coordinator works with them on. Does that happen a lot? Not at all. Now, I will tell you, depending on the state you're living in, Florida, no problem. They're easy peasy. North Carolina's easy peasy. When you start getting more up toward like New Jersey and them, there's a little bit more rules and restrictions, you know, for us as a program. So we have to make sure that we can go through their hoops, to so that you can do practicums in their state.
So that's a great point for the students. We do get students from all over the United States who come here for a year to do our program. So if you're going to be relocating to another state, that's something you need to check with the admissions advisors to see if it's doable for you to be able to do ECPI from there.
Right off the top of my head, no for New York, no for California, no for Tennessee. There's a lot of states, right? So I'd have to look at my spreadsheet. But for the most part, we work with, I would probably say 75, 80% of all the states. That's a guess.
Any other questions?
That's some great questions.
Mm-hmm. Yes, very good question.
Free to reach out if you've got any other questions. I'm happy to help you.
Yeah, it doesn't look like we have any others. So I know they're going to ask me and I don't have those answers. So what would who is their best contact person if we hang up and they have questions?
They're going to have outreach again today, by this evening, by tomorrow morning, from Laura Lincoln and Jamie Doby. So they'll be the first firefighters with questions. And if we don't have the answers, we'll track them down. But you can watch for communication from either Jamie or Laura, and then we'll take it from there.
Yeah, Jamie and Laura are great about asking me a question if you know they don't have the answer. So we're pretty quick to resolve those types of questions.
Well, thank you for coming in and speaking to them. I know this is something that many of them are interested in, so this was wonderful. Oh, I do have one other question that popped up, and it says, is there a document for us to see all the classes for all 18 semesters?
Yes, and they're not semesters, they're terms, just so you know. Okay, so they're 18 5-week terms. And yes, both Jamie and Laura have a copy of the curriculum guide for the January 2022 cohort. And that would be considered cohort, well, no, maybe I don't have that. No, I didn't give that to you yet. I think I gave you August. I'll make sure I get that to you. And that would be considered cohort 11. Yeah, that's a little off my radar right now. I'm getting ready to take in August applicants.
All right, anyone else?
And quite honestly, they could give them a copy of the one from August. That would suffice. If they're just interested in seeing the list of the courses, that's fine.
Okay,
Great
I think
questions.
that's it. Thank you so much.
You're welcome. Thank you so much for
Thank
taking
you,
time to
Tracy.
meet with us today.
Oh,
Really
absolutely.
appreciate it.
Congratulations, you guys. Finish strong. Thanks for having us.
Yes.
Thank you.
Yes,
Y'all have a good
Thank
afternoon.
you. Thank you very much.
Bye.
All right. Have a good day.
Thank you.
All right.
All right, excellent questions. Hopefully that was informative so that I know many of you want to become nurse practitioners. Some of you do relocate, so you're going to have to get some of your questions answered, but hopefully that gave you an overview of the program. Hopefully some of you feel a little bit better about having to have that GPA that you've worried about since the day that you started school. So it's 1:45, we're almost at an hour. Does anyone else have any comments or questions or anything that they would like to add about the potential for returning to ECPI for your master's program?
I forgot to ask. So they say that there's gonna be one program that will start in January, and is there another cohort starting next year?
Yeah, it sounds like they have at least 2 a year because they're getting ready to start their August cohort, which you wouldn't be eligible for because you have to have your license and work for 3 months. And then the next one's in January.
Yeah, I was thinking about
starts.
So there's gonna be a cohort that will start on August 2022, correct?
I would assume that that's their start date. It's kind of like how we start January, July. They probably start January, August every year. So probably cohorts a year. Okay. And, you know, that is something to take into consideration. I am glad that they recognized, because we had some students start ECPI's program with starting a new job, and it was so overwhelming. So they're kind of allowing you the 3 months to get through orientation, but you have to consider how you are. What you have going on in your personal life. What kind of job are you taking? How much training is involved with that? Because when you look at the grand scheme of things, January may be really tight for you. So you can consider August, you can consider the next January. You know, you don't have to do things so fast that you end up really struggling because you have a wedding coming up, you have a trip you have planned, you think that starting a new job in a critical care area is going to be a lot, which it is. So you really have to look at all of that, and don't make it too hard on yourself. If you wait 6 months, if you wait a year, when you look at your entire career, that's no time at all for your quality of life and to really optimize your success. Because if you don't want to get overwhelmed and then end up maybe having to drop the program or, you know, whatever it is. So, and everyone's unique. Every single one of you has a unique situation and personal life and how it is starting a new job and all of that. So just take all of that into consideration. Don't feel pushed. Don't feel rushed. If it's right for you for January, great. But if you feel like you'd rather wait till August, or you want to give it a year to really get comfortable in what you're doing so you're not learning at work and then trying to learn at school, then you do what's best for you. That's my best advice. So I wrote down a couple of things. Yeah, sure. Absolutely. So just to kind of reiterate, somebody apparently is going to reach out to you. So it's not that you have to initiate contact. So look for that today or tomorrow. If you start having questions, jot them down so that you can get them answered, especially if you live somewhere else or you're relocating somewhere else. That's going to be important for you to identify. Find out, you know, that's something to take into consideration too. If this is something you really want to do about that employer program that they have, because having tuition reimbursement or tuition assistance, that's huge. So you do, you know, it sounds like most Orlando Health, Advent Health, they're partners, but not everybody's going to work in a big hospital system. So that's a question to find out if you're trying to decide to take a job, if they are a partner, if you know that's the route that you want to go. There's no fee for you to apply. So it is something you can do. They waive that. Most programs, you probably will have an application fee. And then just make sure you guys graduate in July. And for passing the NCLEX, statistically, students do the best if they can take it within 30 days. 30 days of graduation, and you're just going to have gone through that ATI live review. But you want to be able to pass the NCLEX, start working. And this would be obviously if you're planning for that January start, because you don't always start the next day after you get your license. Sometimes they don't have you start for a little bit of time. So something else to kind of consider is when can you start to get into that January? If not, you wait till August. That's pretty much all I wrote down. Any other questions? Anything else you want to chat about as it relates to that? No? Okay. So it's 1:50. You guys can go ahead and take a 10-minute break, and then we'll meet back here at 2 o'clock and we will start class.